Claudio Orlich. I'm from San Jose, Costa Rica. I do most of my cases are cataract surgeries. I did a fellowship in cornea and refractive surgery, but with the years I became more a cataract surgeon. So most of what I do today is cataract surgery. Well, we know that ultrasound is not the only factor that affects endothelial cells after cataract surgery, but it's one of the most important. So all what you can do to fragment the cataract without using ultrasound will help the patient to have clear corneas or less inflammation after surgery. miLOOP is a new device that is just FDA approved that helps you to break the cataract in 2 or 4 pieces, or as many pieces as you want. It's a new device that is like a wire that goes around the nucleus, around the cataract, inside of the capsular bag. And when you close this wire, it will break the cataract in 2, or you can turn the cataract again and break it again and have 4 pieces. So the idea is that you have the opportunity to use less ultrasound, and it will help you mostly for hard cataracts. In Latin America or in India or in Africa, we have a lot of patients with really dense cataracts or really hard nucleus. In these cases, you have to use a lot of ultrasound. We have a femtosecond laser, but femtosecond laser don't work in these kind of cases. It don't break the cataract in pieces or don't fragment the cataract. So I think miLOOP is a great device for this type of cases of hard cataracts. Well, I think that one of the advantages is it's like an instrument. It's a small device that goes through a small incision. Your clear corneal incision of 2.2 or 2 millimeters will be okay. Compared with other technologies like with a femtosecond laser, it only helps you to fracture the cataract. It don't help you for the capsulotomy or the capsulorhexis. So I think you can combine it with other technologies, but one of the main advantages is that for those really hard cases, it will help you a lot to fragment the cataract, and you start with you convert a very hard case in a very easy case. Limitations, well, it's made by a small company, so it's not available over the world. It just started in the US and in a couple of small countries like Panama and in Costa Rica, but eventually will be available all over the world. But because it's a small company, I think that one of the limitations is it's hard to get it in other parts of the world. For me, I don't think that regular patients with soft lenses or soft cataracts, I don't think it's necessary to use miLOOP. For me, the ones that really are important for miLOOP it's the ones with really hard cataracts that give you that you have to use more energy or more ultrasound, and also are those cases that you can have more complications, and using miLOOP makes it easier, and you have to use less energy for remove the cataract. Well, it has a fast learning curve, but you have to be careful when you open the miLOOP that you're inside of the capsular bag, so you avoid any damage to the sonula. So I think that's the only tip that I can give new users. And also is when you break it in 2, it's very safe. When you start to breaking it in more pieces and you open this device inside of the capsular bag, you have to be careful that you don't push the capsule, because you can have a rupture of the posterior capsule. But for beginners, I think it's easier only to break it in 2. And when you have more experience, you can break the cataract in more pieces.